G'day, my name's Paul Bergamo, and with Dr. Carlo Rinaudo, we are owners of NeuroLogic Education. NeuroLogic Education stemmed from a successful dizziness seminar series facilitated by Carlo in 2016 that was presented to 250 chiropractors in Australia and New Zealand. In 2017, NeuroLogic Education is presenting a seminar series entitled Brain-Body Connection, Enhancing Spinal Function and Falls Prevention. Now, as a chiropractor, let me ask you three questions. The first question, with regards to research, where do you sit? We don't deny the value of back pain, neck pain, and headache research, but what about research that pertains to chiropractic and how the brain works? Secondly, with regards to assessments, are you able to do an assessment that tells us about how the brain and body works together, or a falls screen assessment? And finally, how do you communicate these messages to your patients as well as to the community at large? NeuroLogic Education is bringing out its inaugural speaker, Dr. Kelly Holt, in late April for Melbourne, in early June for Sydney, and in late June for Perth. Now, Dr. Holt is currently the Dean of Research at the New Zealand College of Chiropractic. Besides his chiropractic degree, he also holds a Bachelor of Science majoring in physiology and a PhD in health science from the University of Auckland. Dr. Holt's PhD focused on the effects of chiropractic care on sensorimotor function and falls risk in older adults, and he was named Chiropractor of the Year by the New Zealand College of Chiropractors Association in 2014. Hi Kelly, how are you going?
Yeah, great. Thanks, Paul. I'm really looking forward to doing these seminars with you and Carlo. I think we're going to have a lot of fun and share some really good information with the people who come along.
So Kelly, what's your role at the New Zealand College of Chiropractic?
Well, last year I took on a new role at the college, which is the Dean of Research. It's a new role that we've just established, which I think is a really good move and a really exciting role for me to be in. One part of it is I'm in charge of the day-to-day running of the research centre. So that's making sure that the grants get written, that the projects get done and everything ticks along nicely there. And the other part of my role is making sure that there's really an evidence base to what we do at the college. And that involves things like upskilling the staff and faculty about research, getting them involved in research projects, getting the students involved in research projects, and also making that the curriculum is based on scientific evidence. So I've been going through reviewing all of the courses we teach at the college and seeing where we can increase the research content of those courses where possible. So it's a really cool role that I'm really enjoying.
Kelly, your recent paper presented at JMPT in 2016, as well as your PhD, focused on chiropractors' role in falls prevention. What can we expect in this upcoming seminar on this topic?
What we're going to do in the NeuroLogic Education seminars, Paul, is we're going to take a look at falls and their risk factors. We're going to look at things like sensorimotor integration, and in particular sensorimotor integration that's relevant to falls risk, and how chiropractors may play a role in improving sensorimotor integration that's relevant to falls risk. What we're also going to do is we're going to look at providing a falls screen that chiropractors can do in their practice so that they can hopefully identify falls risk factors in their patients and give them some information about what they can do if they do identify these falls risk factors. So we really want to make this a hands-on seminar where we're giving the chiropractors who come along more tools for their toolbox so they can go back to work on Monday morning and hopefully, if we do our jobs properly, help to prevent falls in their patients. And that can ultimately save people's lives, which is a pretty cool thing if we can help to make that happen.
Fantastic. What does the evidence say about enhancing brain function with chiropractic care?
Well, for about the last 15 years now, our research group has been developing a model and testing it that looks at how chiropractic care may enhance brain function. And I think it's becoming very, very clear that spinal function does have a big impact on the brain and in particular motor control. And of course, as chiropractors, one of the big things that we're trying to do in practice is improve spinal function. So in the seminars, I'll be looking at the research that shows the connection between chiropractic care and the brain. And also we'll look at some of the clinically relevant research that's going on at the moment and also sharing some of the things that we've got planned that looks at the effects of chiropractic care on the brain and how it might enhance brain function, in particular in people who are really struggling with issues with their nervous system.
Kelly, what is sensorimotor integration and what can we expect at the upcoming seminar on this topic?
Well, to put it really simply, sensorimotor integration is all about the way that we perceive, process, integrate and respond to sensory information that's coming into our nervous system, particularly when that response has a motor control or a movement component to it. So what we're going to be doing in the seminar is we're going to look at sensorimotor integration in a bit more depth. We'll look at the research that's been done that looks at how chiropractic care can have an impact on sensorimotor integration. And probably most importantly, what we'll be doing is teaching the attendees who come along how to assess sensorimotor integration in their patients and identify issues with sensorimotor integration and track whether those issues improve or not with the care that they're providing.
Terrific. Kelly, there are some detractors with some of the research that's come from the New Zealand Codes of Chiropractic. I've had chiropractors come up to me and say, for instance, if I move my hand, it does affect my brain. So what's the big deal about an adjustment and its effect on the brain?
Yeah, we do hear comments like that a lot, Paul, but really we're playing a long-term game here. So a lot of the work that we've done up till now has been all about trying to understand what changes in the brain when we perform a chiropractic adjustment, which is then going to lead into the next stages of our research program. Where we really run into trouble though is we might report that something changed by 20% in the brain. And then what happens is that ends up on social media by saying chiropractic care improves brain function by 20% and it makes you smarter. And a lot of these early studies, we really don't know whether the changes we see are beneficial or not. Some things certainly are, but some changes, it's just a change. But where we're taking this research is we're looking at clinically relevant people and using clinically relevant outcome measures to try and work out whether these changes that we've seen may really be beneficial and may help people as far as their health, wellness, and maybe even their quality of life goes. So we've been moving into that next stage of the research program recently, and I'm really looking forward to sharing some of this research that we've been doing recently. So like I say, it's a long-term game, and I think where we really run into trouble is when the research that we're doing is interpreted inappropriately.
Dr. Kelly Holt will be presenting the research, Dr. Carlo Rinaudo will present the clinical applications, and I will conclude the seminar discussing communication and clinical integration. Now the dates. Melbourne, April 29th and 30, 2017 at the Ibis Hotel. Sydney, June 3-4 at Ridges Central Hotel. And Perth, June 24-25 at the Mercury Hotel. Further details and registration can be found at www.neurologiceducation.com.au. Any final thoughts, Kelly, regards viewers to this interview with the upcoming seminar?
Sure. I've spent so long working on this stuff all through my PhD, and I'm really looking forward to taking this opportunity to come to Australia and share this information with the chiropractors who come along to the seminar. I think we're going to be talking about some really interesting neuroscience that underpins what we do as chiropractors. And finally, although it's not a technique course, what we're going to be doing is providing some really good tools for the chiropractors to put in their toolboxes, take back to their practices, and hopefully do a better job of caring for their patients.
We look forward to sharing this seminar information to you, the delegate, at this upcoming NeuroLogic Education Seminar.